Hey, this is Dr. Robert Mickley. I have a case here to want to discuss of a simple 2-implant immediate extraction case with immediate implant placement using the new Forte implants. So we're going to be setting up this case as 2 simple implants into the sockets. I'm going to use placing them in more or less the ideal bone here. This tooth is interesting. It looks like there was once upon a time a tooth extracted here and some sort of a sinus lift done. Not by me, the patient just came in as is. So we're going to be extracting this tooth number 3 and placing as well extracting tooth number 5 as well as an immediate implant in that socket. So it got to be very helpful here to get us right up to the sinus floor. We'll probably do a sinus bump here just to get a little bit more stability into the cortex of the sinus floor. As we see here, the bone is mostly taken up by the tooth itself, and the socket itself will be empty and not a lot of bone to engage. So I'm going to drill my guide just shy of where the sinus is, but actually place it and lift the sinus slightly to engage the cortical floor of the sinus, get some primary stability so we can place this implant immediately. So the way we'll do that is we're going to bring in the patient's intraoral scan and we'll let it do an automatic alignment and we'll check that. And when we check the fit of that is we want to see a tight connection around the tooth all around with this green line. We want to see it's really nice and very, very tight, which it seems to be here. Also around those roots that are in the posterior. And it appears to be a nice tight fit. Okay, and we'll go with that. Perfect. All right, so now once I have that, I can turn off the skull itself because now I'm lined up and I see where my teeth are. Now if I want to see it in occlusion, I'm going to bring in the lower jaw, but I'm not going to bring in the lower jaw to merge it because this patient's biting on a stick. If they're biting an occlusion on the CT scan, a merge is very difficult to get without the cusp tips being clearly visible. So we have them biting a bite stick when they're taking the scan. So when I bring the lower jaw in, I'm not going to bring it in to merge it onto the lower because that's not important to me right now. What I want to do is merge it onto the upper. So I'm not going to merge this to lower jaw. I'm just going to hit X here, but I am going to align it to model. I'm going to align it to the maxillary model, not using points, specifically not checking this box. That will allow it to mesh together to the bite we got with the intraoral scan. And that's exactly patient in occlusion. Again, if I aligned it, it would be an open bite and not helpful for what I'm looking for here. So what I want to see is my exit holes are going to be hitting more or less close to the buccal cusps of these two to be in class 1 occlusion, as it is more or less on the other side. So as long as we're in that ballpark, this one I can angle slightly more towards the buccal, as long as that works surgically, which it appears to. Okay, I should in pretty good shape there. And now, what I'd like to do, we'll hide this lower model. So when I'm making a guide here, this tooth, the crown is already broken off. All we have are roots left. But this tooth still has the stump of what was left of that bridge. So if I try and make a guide over this, this is just going to be in my way, and it'll be a void, bringing my my sleeves a little bit higher than I'd like. So what I'm going to do is I'm going to bring this into mesh mixer, flatten off this tooth so it'll appear in the mouth as it is after the tooth is extracted. So again, when I do that, I bring it into mesh mixer. And I can use a cut feature on Blue Sky Plan, but I find it's just a smoother model than mesh mixer. And it's a very simple select tool. Bring our brush size down, so I'm just selecting just this prep tooth. And again, it doesn't have to be perfect, and you'd rather remove a little bit less than a little bit more. If it's a little bit less, the guide will have a void underneath it, which is not a problem at all. If I remove a little bit more, the guide will have an impingement because it won't seat all the way. Right, as long as we get it close, more or less. Good. And then we'll hit the B control to smooth those borders, and we'll accept that. We get a nice smooth selection here. And then we'll hit File, Erase, and Fill, and that will smooth it out pretty well. We can check the bulge feature to flatten that even. It'll drop more. And this is basically going to be what the socket will look like after extraction. We'll hit Accept, clear the selection, and then we're going to export the file back. And I'm going to put it back into the patient's file, or we're going to call it extraction model, and that's what we're going to build our guide on. I don't need to save this because we just exported the model. I don't need to save the mesh file. Good. We're going to bring that back into Blue Sky Plan, and that we can either adapt to the maxilla again, but it won't be quite as accurate because it's missing that tooth. So I'm just going to hit X here, and I'm going to go to model and go to the maxillary, and it's going to mesh itself because it's essentially the exact same model minus that little stub. And you can see the yellow is just kind of, you know, ever so slightly poking through here, except for this spite where the tooth is missing. So now I'm going to turn off my green model, and now I only have the yellow model, which is less tooth number 4. Okay, now it's simply making a guide. We're going to turn on our guide sleeves. We're going to say fully guided kit. And without any adjustments, we're going to be clear of anything in the way. We are going to draw ourselves in the guide panel a curve. And I don't have to make this quite as far as I did here. I often will just make this sitting on a couple of teeth. Beautiful, that will work fine. I like sharp borders at the end of my guides, just to make sure they're seated. Blue Sky Plan will automatically kind of bleed out the borders for you. I like to be nice and sharp. So making a window over that will allow it to show me that it's going to be a nice sharp border. You'll see what that means in a second. And we'll hit Create Surgical Guide. And that's what it gives me, a nice sharp border. So when I see this, I know this is essentially a window. I have another window here, and I have 2 teeth in between. You could put another window here if you'd like, but to me that's going to be unnecessary. I have 2 teeth to verify and 2 teeth in the middle that let it hold. It'll also be sitting on the posterior of the jaw, as that's not going to be affected at all. It's still in the soft tissue. So that'll be a nice solid guide. We'll be able to get our osteotomies just shy of where we need them to be, do any sinus grafting that we need to do, and get our implants in place immediately in a very efficient manner.